Okay, good morning, everyone. Thank you for having me here. So, basically, the work that I am going to present today is basically really actually a kind of collaboration between the University of Eastern Finland, the Kuopio University Hospital, which is also actually basically, a full member of the European Ear and Epicare Network, as well as the Montreal Neurological Institute Hospital. Yes, thank you. Epilepsy is basically a chronic, non-communicable, multifactorial and systems disease that is estimated to be affecting between 50 to 65 million people worldwide. And actually, it is often characterized basically looking at the focal onset, for example, in which only actually then one of the hemispheres is actually being affected, versus, for example, having the generalized actually onsets in which basically multiple parts of the brain are actually involved in this kind of a network, basically like disruptions of the functions, as well as sometimes basically having unknown onsets. Well, the good news is that basically up to 70% of the patients can actually live seizure-free if they are properly diagnosed and treated. And it's still actually, basically like a drug therapy using the anti-seizure medications is basically actually then the most common course of treatment. However, this kind of therapy may actually fail in actually at least 30% of the cases. So actually then, in this case, if patients are actually diagnosed with having focal drug-resistant epilepsy, so actually in that case, the surgical resections of the epileptogenic zone is quite important. But this success really actually depends on the precise localization and detection of the epileptogenic zone, looking at the preoperative MRI. And so, for example, here we're actually showing one of our own patients for whom basically actually with this kind of the preoperative T1 weighted imaging MRI actually sequences, as well as the FDG PET basically indicated having actually having this kind of a lesion on the left hippocampus. But then, of course, actually at the same time, this kind of actually basic detection is sometimes actually challenged by the fact that for basically almost half of the patients, they actually will have these MRI negative scans, meaning that either the anatomical actually changes have still not been actually occurring in the brain, or maybe actually the problem is that the current, for example, MRI protocols, the sequences, the field strengths, are still actually basically not able to kind of localize this kind of the abnormality in the brain. And so actually then, because of this, in these cases, the clinician's expertise is immensely important. And so they always actually try to actually rely on actually this kind of the multimodal neuroimaging, neuropsychology, basically cognitive tests, as well as the semiology, which actually includes basically assessment of the clinical signs and behavior of the patient, as well as extensive actually seizure calendars and history. And so actually then, in the literature, basically, it has been reported that brain regions that are actually specialized in the case of the learning and memory, particularly the neocortical regions, as well as the hippocampus, are more prone basically to this kind of the epileptic seizures. And then, at the same time, associations have been reported between memory dysfunctions, as well as the risk of future basically epilepsies, especially in the case of the hippocampal deformations, rotations, variations in the signal intensity, as well as the structural connectome reorganizations in the brain networks. And so actually, basically, these kind of actually findings have been reported for both basically human patients, as well as the basically rat models, animal models. And so actually, recently, a kind of a large study reported that, so actually we're looking at the histopathological analysis of the resected tissues, basically, in the case of the adult patients, hippocampal sclerosis, as well as the tumor-related malformations, and then finally different types of focal cortical dysplasia are basically the most common types of the etiology, basically, in this case. And actually, because of this kind of the prevalence of the hippocampal sclerosis, ILAE, that actually stands for the International League Against the Epilepsy, has been actually releasing these kind of the classifications, in which basically, in which the neuronal cell loss as well as gliosis, it can be, for example, happening in the case of the basically, for example, here, CA1 and CA4 in type 1, or for example, only CA1, only CA4, and as well as basically sometimes only for example, this kind of the gliosis reactive changes. And of course, actually, then like in actually so like all of these different types, basically, so actually the region of the dentate gyrus can also be actually well affected in different basic ratios. And so actually, basically one of the main goals of this presentation is basically introducing and also showcasing the project that has, and basically actually that has been actually started back in 2022 between the University of Eastern Finland and the Kuopio University Hospital, titled The Multi-Scale Assessment of Epileptogenicity in the Human Brain for Better Diagnosis and Treatment of Drug-Resistant Epilepsy. So actually, here basically are patients who have been actually diagnosed with the case of the focal drug-resistant epilepsies. So actually, in this case, basically all of the different etiologies, they are actually admitted basically for the case of the extensive, almost 90 minutes of the research sequence MRI 1 day before the surgery. And then after that, basically actually, for example, this kind of the resected tissues, at the OR, they're actually marked using actually a specific basically metal clips, and then after that, the samples are actually transferred in our institute, where the neuropathologist basically actually dissects the tissue, and then after that, basically actually distributes, so actually in this case, basically the adjacent slices between the actually, basically the two different research groups. So actually always basically one of the slices is actually processed in terms of the microelectrode array, the patch clamp, different types of omics, as well as the electron microscopy. And then at the same time, the immediately actually adjacent slice is actually processed using a kind of a microscale imaging, basically with the field strength of 11.7 Tesla, in which basically the anatomical scans as well as the diffusion basically actually sequences are actually recorded, and then at the same time, the same tissue is also actually processed, and actually here, what we're actually showing is basically the bright field microscopy of the Nissl as well as the myelin actually section. So actually, basically all of these extensive multimodal as well as the multi-actually scale basically data acquisition, as well as our actually notes media, together actually, with this kind of the basic, the preoperative as well as the postoperative actually clinical notes and diagnoses are actually being integrated into our basically extensive research data management system under a specific data organization and data protection plan. And so actually, here, basically here, I am actually going to be talking about the first part. So actually, here, what we are reporting is basically actually this kind of the initial results, looking at the heterogeneous data set of the preoperative actually anatomical scans, as well as their post-operative histopathological diagnosis. Here, we have actually included basically a total of 17 different patients with temporal as well as extratemporal lobe actually epilepsy. So actually, we all basically have been diagnosed with having focal actually DREs, and then as well as basically actually a total of the healthy volunteers. Their average age were almost identical. And actually, here basically our extensive research sequence MRI has been actually recorded using a 3 Tesla Siemens scanner, in which we're actually first of all basically recording actually 3D basically basically actually basically a 3D 1 millimeter actually voxel size T1 weighted imaging, as well as a normal actually T1 using basically actually fewer number of slices, plus of course actually having the resting state fMRI, MREG, as well as actually this kind of the EPI sequence together with actually basically more actually novel sequences, so including RAF4, as well as the massively multidimensional MRI that has been actually developed in collaboration with the Lund University in Sweden. And so actually basically in the case of our patients, so actually, basically actually the current, for example, the preoperative clinical notes, they actually indicated that, well, basically the majority of them, they were actually actually diagnosed with the case of the focal, basically focal cortical dysplasia, FCD, followed by actually, for example, the different types of the hippocampal sclerosis, dual pathology sometimes, as well as tumor malformation, encephalocele actually disconnection, and even actually, for example, one case of actually having a structural epilepsies, but actually, for example, not really a kind of clear actually etiology. And then, well, after that, basically, once the surgeries were actually conducted, so actually, after that, basically, the resected tissues, they were actually processed by our neuropathologists at the hospital. And actually, in this case, basically, the etiologies changed for a lot of these patients. So actually, here, basically, the importance is that, so then, for example, looking at the case of and basically actually, for example, looking at the MRI-based, the clinical presumptions of the etiologies, they basically actually, resulted basically, in this kind of actually changes in the histopathological confirmation, where basically the majority of the patients, they were actually diagnosed with actually having basically hippocampal sclerosis, fewer actually cases of the FCD, etc. And actually, because of that, with this kind of the changes from the MRI-based, presumptions to the post-operative histopathological-based actually confirmations, actually show us the importance of basically actually having to actually improve basically the case of the sensitivity as well as the specificity of the pre-operative MRI detection technique. And especially actually here we're actually we're going to be talking about the hippocampal volumetry in the case of the patients as well as their actually age-matched healthy volunteers, and then we'll also actually looking at the validation of the hippocampal segmentations. And actually, because of that, we basically actually use the 3 Tesla T1 weighted actually imaging, from actually these patients, and then we actually process them basically with the HIBALL toolbox, and then after that we actually ask actually and basically actually one of the experts, neuroradiologists, he actually, basically assessed, all of these segmentation results. And so actually, he basically concluded that, basically in the case of patients as well as the healthy volunteers, for example, the hippocampal segmentation results were excellent. But actually, at the same time, basically, for actually, one of the healthy volunteers, for example, the incomplete rotation of the left hippocampus had actually, for example, resulted in actually, quite basically, a large value of the asymmetry, basically, between the 2 hemispheres, especially in the case of the CA2 as well as the CA3 subfields. And then, at the same time, for example, sometimes the small parts of the hippocampus heads or tails were not actually well included, especially actually in the case of the 2 of the patients, for example, for whom the dual FCD-HS, as well as maybe, for example, this kind of the minor actually encephalocell disconnections were actually confirmed after the surgery. And actually, and basically, actually, here on the right, you can actually, and basically, actually, observe the values of these actually, hippocampal, actually, volumetric asymmetry. So then, basically, the left volume minus the right volume divided by the average. So actually, here, basically, in the case of our healthy volunteers, in which you can also actually, basically, appreciate, so actually, quite basically, so actually, here, basically, in the case of the CA2, CA3, as well as the CA4, quite actually, large actually the values of these asymmetries in the case of the non-epileptic actually controls. But then at the same time, in the case of the patients, basically as expected, the largest actually the values of this kind of the asymmetry, they were especially actually basically observed in the case of the patients who were actually confirmed to have the hippocampal sclerosis, as well as, for example, actually in the case of the dual, for example, FCD and HS. And so actually in this case, basically, for actually so actually for for these patients, these kind of actually findings, they were also actually matching the kind of the laterality, of the disease actually the pathology. And actually, so then, in that case, for example, even actually some of our patients, for example, who were actually diagnosed. And basically, in the case of the FCD, as well as maybe actually, so for example, the tumor, etc., they were also actually showing, for example, so actually, and basically, this kind of the volumetric asymmetries, especially in the case of the CA4 and then the gyrus. And actually, so then here, basically, of course, actually appreciating, that we actually did not have basically enough actually, basically actually patients. We basically actually conducted this kind of the statistical comparison between the healthy volunteers as well as the patients with and without actually hippocampal sclerosis, and especially actually actually so actually especially in the case of the CA2, for example, the difference between the patients actually who had hippocampal sclerosis and the controls it wasn't really actually basically statistically significant. And then, well, for example, actually, so like, well, here I'm actually then like, well, showing actually then like, well, the case of one of the patients for whom basically the MRI notes had actually so like, well, indicated basically like, well, having the dual FCD as well as the hippocampal sclerosis, but after the surgery, the only confirmation was actually like, well, having the type 2 of the hippocampal sclerosis, and then, well, at the same time, nicely, basically, you know, so actually then like, well, basically like, well, the kind of the hippocampal actually like, well, segmentations, you know, so then, well, they were also actually then like, well, in line basically like, well, with these findings, as well as the and basically actually like the variations in the case of the gyrifications as well as the surface area, you know, and then well after that basically actually, and actually so then like well another actually like the patient for whom basically like for this kind of the preoperative like the notes, they were not really actually like basically like the conclusive, but then like later on they were actually so actually diagnosed with actually like having the dual pathologies, and actually so then like in this case basically the findings were not completely actually like matching this kind of the laterality of the disease. And actually, so then, well, in this case, basically, like the conclusions is that, you know, so then, well, of course, the importance of the multimodal comparison as well as the validations, you know, and then, well, of course, actually, then, like, well, the need to actually, well, and basically also actually, then, like, consult basically with the experts, like, the evaluations as well as the diagnosis. But then, well, of course, in the case of the actually, basically, like, for morphometrics, we definitely actually, like, we need to have a larger, like, a sample size. But then, well, at the same time, the deep phenotyping has to actually, like, be conducted in the individual patient level. And of course, actually, like for the importance of actually like extending actually so like for this work, you know, into actually like for the case of the diffusion, you know, as well as the histology actually staining, and then finally the importance of the data integration. Thank you for your attention, and then at the same, okay, I think it's a different version. Yes. Yes, and actually, so then, like, thank you actually, so like, for your attention, as well as all of my actually, so like, contributors from the UEF, Kuopio University Hospital, as well as the neuro, actually, you know, and then, well, with that, I would also actually like to thank the ERCO Foundation for their financial support. Thank you.